cord out to the nerves, your body will function at what percent?
100%.
100%, you're exactly right. What I care for as a chiropractor are called subluxations. Subluxations are minor misalignments that interfere with the quantity of those signals. So if I'm only getting 80% of the signals going down, then my body functions at 80%. See, I haven't changed all these years, still doing that same report. Maybe back, you know why? Because it works. And anytime your body functions less than 100% over a period of time, comes the sixth program. Okay? It begins to break down. Once it breaks down so far, that's when we have symptoms. Every health concern known to man, okay, starts with 100% expression of health, less than 100% expression, breakdown, then symptoms. Medical doctors are awesome, okay, and I'm gonna have some medical doctors out there, that's okay. Medical doctors are awesome to take your symptoms back to breakdown. Our goal is to get you functioning at 100%, okay? But we have to talk about these outside stresses impacting the nervous system. Misconception. We just talked about that. Some people think we're back doctors. Like I said, I used to do this off the top of my head when I used to have my PowerPoint slide. We are nerve doctors. Our job is to keep the nerve, and I say nerve system to the lay public, because some people think nervous is this. So I say nerve system. This helps you combat the effects of stress in your life. So we're not back doctors, okay? We're actually nerve doctors, okay? If the nervous system was in your thumb, I'd be called a thumb doctor. Everybody understand? So we use that adjustment of the spine to affect the nervous system, but we're not taking care of the back. Okay? It's just like a medical doctor. He puts a pill in your stomach. Is he called a stomach doctor? No, he's usually has to get your blood system. So medical doctors use the blood system to affect the body. We use the nerve system to affect the body. When I did my what controls every function, I kind of did that a little bit earlier already. So what controls every function of the body? The nervous system. And then the brain. You're exactly right. We just did that. The brain controls every single function of the body system down the spinal cord. So you get 100% of things within that spinal cord, you're functioning 100%. Chiropractors take care of subluxations. They interfere with the quantity of those signals. If you're getting only 80% of the signals going down, your body begins to break down. Once it breaks down so far, then you have symptoms. Just like heart attack, kidney failure, cavities in teeth, cancer, and subluxations. Every single one of these things, by the time you have symptoms, the cause has been there for a period of time. So again, it takes time for the body to break down. So when I start working on a patient, what do you think it's going to take to get them better? Time. So I'm telling them up front. It's not going to be one adjustment over the phone at no charge. You know. We just had a patient. Well, you take walk-ins? No. I know how to walk in once. And we'll walk in, get on the table, get cracked, and walk out. No, we don't take one. Well, can I schedule? Yeah, you can schedule. Okay, but the doctor's going to do a consultation. There's no charge for the consultation. The doctor will do an examination on you, and x-rays may be warranted. We tell them that. No, that's okay. I don't want them coming in. Okay? And that's the one advantage of having a referral practice. Is people are coming in, they know you're going to do an exam, they know you're going to do an x-ray, and you know it's not going to be a one and done thing. And I discovered that, because the social media of my time was the Yellow Pages. And you want your name in the Yellow Pages. And when I moved from below the hill on top of the hill, started that group, we moved in October. The new phone books, I mean, that's a big deal. Phone books are out, You know, it's like, oh, my website's up. And phone book came out in November. And I had asked Illinois Bell, who was in charge of my phones at the time, okay, will I have the same phone number? Yeah, you have the same phone number. They were wrong. Okay, I had a new address, a new phone number. I wasn't in the Yellow Pages. Somebody at Illinois Bell hit delete burns. My house, which I didn't move, was deleted. I didn't exist, according to Illinois Bell, for a year. We grew by 50% because I was mentally excited about the new office. So it's not about slick ads and all this stuff. Slick ads And some of the stuff they do on the internet, you know, get $20 exam, whatever, that might bring somebody in, but you think I get quality people with that? You know, but just, and this is so hard. Been around a long time. Everybody know Eric Russell, by any chance? Okay. Eric Russell, he practiced in Quincy, Illinois. When he was a young pup, he didn't have any money, and he was interested in our state association and the IC. So I picked up his meals in his hotel and stuff like that, you know, to go to seminars, getting started, be active. And long story short, he ended up teaching at Parker College Chiropractic and became president of New Zealand College Chiropractic. But now he's back. He's not at New Zealand, where he's back at Life University doing consulting. Now, his wife, Yvonne Villanueva Russell, she wrote her PhD, she's a PhD in sociology. She wrote her PhD thesis on chiropractic. And that's the only thing that gives me hope right now. Because chiropractic goes in cycle. Straight cycle, mixing cycle, straight cycle, mixing cycle. And unfortunately, I've been around long enough to see that, but we're sure stuck in this down cycle right now, you know, which is just breaking my heart. And here's the difference. When our philosophy is strong, people start their own practices. When our philosophy is weaker, people want to associate. And there's no wrong or right with that. Right? But you have to look at associateship as continuing education. You know, you're not going to start an associate to get $1 million. You know, you eventually want to be on your own, right, Chris? Yeah. That's just the way we're constructed. See, everybody in my generation started their own. You know, why would I want to work for you? I'm going to start my own. I mean, that was our attitude back then. And Dr. Godson was weird because Alex Cox was an associate to start off with. You know, I'm like, why did you do associate? Yeah. But unfortunately, that's changed every time we go through a bad cycle. Hey, that's a sidebar. Oh, so it's Yvonne's paper that's giving me hope that we get back into the good cycle again. Okay. But every single one of these, okay, how many of you know somebody's had a heart attack? Okay, how'd they feel 3 days before? They felt okay. All right. Now, did the heart go bad in that 3 days, or take a long period of time to break down? A long period of time. How many of you had a cavity? You know? And now, by the time you felt symptoms of that, how long do you think that cavity was there? A long period of time. Some sensations that I care for, okay, I don't use the T-word. Okay? I treat people on Halloween, that's it. Okay? That I care for, okay, are the same. By the time you have symptoms, the cause has been there for a period of time. Okay, chiropractic care. Okay. I think I said this. Chiropractic care for something different if the quantity of the signals traveling down the spinal cord out to the body. The best time to see a chiropractor is before symptoms start. Okay? How many of you see a dentist? Okay? And do you just wait till your tooth hurts? No. Why do you go to the dentist? To prevent things. See, my grandparents went to a dentist to get drilled or filled. Okay? And preventive dentistry got started when I was in grade school. They had dental hygienists go to the various schools and talk about the importance of brushing your teeth. And they had these little red capsules you put in your mouth, let them dissolve, and then wherever plaque was, the red be there. You go, oh, geez, it scared the bejeebers out. So we went home, we scrubbed our teeth. And so, just like dentistry, okay? A lot, you know, I tell my patients, I says, you know, my grandparents just got drilled and filled, and now people get preventive dentistry. Okay? Same thing with chiropractic. A lot of people use it as a treatment, but now it's more about prevention, right? Because every single symptom you get has been there for a period of time. All right, everybody got it? And I'll be honest, if I have a patient come in that has 3 front teeth, you know, I'm thinking, this one might be a hard sell. I have some exceptions. By the way, you know what has 8 teeth and 100 legs? I don't do this with my talk, I don't. Yeah, it just entertains me.
Centipede?
Centipede, that's a good guess. No, it's the front row at a Willie Nelson concert. Sorry, country kids.
That's fine.
But if you don't like anything I say,
I made that simple.
I won't take my speaking fee. Hey, chiropractic can benefit you and your whole family, right? We take care of people from the womb to the tomb, cradle to grave, right? Some of my favorites are babies, you know, because they don't have old chronic problems to take care of, okay? And I said, as a lot of you who develop a lot of chronic problems, I still work with you. And then I use MyoVision in the office, right? And I meant to load up some new slides. This is old, I don't know how long ago this slide is made. When I go through it, I share MyoVision. Okay? And the technology I use to correct or to monitor subluxation is called MyoVision. And that's how the body adapts to stress, right? So green is good. Yellows mean low reading, browns mean high, red's high. So you think this person has a lot of problems? And I don't say they had arm pain, I just say, do you think they had a lot of problems? Oh yeah, I have a lot of problems. Okay? And this is a measure of stress. Okay? Green is good. Okay? All right. And I've changed the colors in my system now. Brown's bad, and red's bad. Okay? So this is a patient we took care of for 30 days. Now we do progress scans. Okay? Now, did we get rid of a lot of the red here? Yeah, got one brown right there. Okay. Now, do they have as much red over here? No. Now, this person said, I am feeling better than I felt in a long time. But should I quit care? No, because I didn't correct the underlying what? Cause. You always make them talk. And here we are 60 days down the line. Do we have a lot more green? Oh, yeah, the person says, geez, I'm doing things I haven't done in years. They're fantastic. And have we eliminated a lot of the red? Mm-hmm. Yeah, okay. See? So it takes time for the body to break down, and it takes time for the body to heal. I want to thank you for the opportunity of speaking to you. Okay? And there's two closes. Okay? I really appreciate this. Okay? Mary, my staff person over here, I know some of you are probably interested. I'll give you a complimentary examination with the MyoVision or whatever you want to do. And Mary can schedule an appointment for that. And then they go see the staffers. Or, okay, I can say, I have a little gift certificate for all of you. Okay, they'll give you a complimentary examination. Okay, could you hand these out for me? You hand these out and everything. Everybody good? Okay, and they do expire within 30 days. And why do I say they expire in 30 days? If you have a coupon to go somewhere, and it doesn't have an expiration date, you throw it in the drawer, I'll use that someday. If it has an expiration date, you're motivated to use it. So that's why you have the close of that. Okay. Now, key point. Thank you for your time. Your certificate, close. Here's what you do not do. Are there any questions? Now, do chiropractors cause stroke? You're gonna have somebody screw up your entire talk. You know, what? You know, so don't take any questions. Okay? Just say, thank you for your time, Bob. So any questions on the stress talk? What's that, Clay?
I was just going to raise my hand and say, can chiropractors cause strokes? Because you just told us not to take questions and then turn around and ask if we had questions.
Okay. Now we're going to get to what I taught for 40 years. The course I designed was called Technique, Principles, and Practice. Because I covered one of the 33 principles every single day and how it affected the practice of chiropractic. That's why that course has that name. And then I had the pleasure of, doing Delta Sigma Chi every quarter and trimester for years. He didn't invite me back. Okay? And then for the, just forgot the sorority's Greek name. Anyhow, the sorority did that, for their plenty classes all the time. So if anybody wants those, I'd be happy to. It's one of my favorite things to teach, because this is our identity. So let me just switch. And if you need a break, there's restroom down inside each door, and there's one in the far end of the hall.
It does. Does sound like an education chair type thing.
Sounds like our education here, so just gotta go talk about it.
We could probably make that happen.
Who's that? Are you the educational chair? Yeah.
No. Me.
You are.
As of like Monday.
That'd be a good first one to start, because it's easy.
Yeah. Yeah, it would be.
Katie, you should compete right now.
I'm gonna go.
Oh. You're a liar. We've been here over an hour, dude.
He knows me too well. I get
Is he
1
gonna
hour
have
in
been holding
class.
It's like 1 hour class. It's like 55 minutes in, and I'm like, oh, I got 5 minutes. I got 5 minutes. Come on, 10. I didn't drink my coffee this morning. No, it's a weird day. No coffee. Weird, dude. Weird. I know.
Good machine check.
No. Sounds like I like it.
Yeah, you're great.
Maybe.
Maybe? Maybe yes, maybe no.
What?
Jason will drive this morning.
You good?
No, I was trying to. We went out towards Claire, and I started driving north. We're at Princeton, Manchee, up to Clinton. It was beautiful.
Yeah, I'm not just wearing it for
But-
March Madness. Not follow it now.
Next time I go home, I think I'm gonna follow
But I
the whole
couldn't
river
crack
home.
it.
You should.
Oh,
And
did
it's
you?
beautiful.
I can literally follow.
You guys take my hair
Beautiful.
My head there.
I just haven't done it. So I'm always in a hurry to get home.
I know. I
I
know.
leave and like I have to get there for something.
That's true.
Yeah, 6 hours. I gotta get there.
It's even worse.
Not stopping.
Maybe.
That's why I asked you when I saw your shirt. I was
You're like, we're enemies now.
That's
Whose last name is
Huh, my opinion has changed. Yeah, I think I am, oh, I'm 16th place.
Hey, okay.
So not last.
Well, she's the better.
That's cool. No, I got two winning.